Perfect, thank you. I didn't realize Paul was giving his talk before me, so this will just be part two of that. He set the foundation, which is wonderful. So we did a study, same thing, looking at Fitzpatrick skin types 5 and 6. We did treat more patients, and we were treating at a higher energy or higher fluence. These are my disclosures. We do a lot of research studies. So as we know, patients commonly complain about acne scars, many of them skin of color. A lot of the treatments that we traditionally have were very limited in what we can choose, what we can do, our parameters, and our technique. So we looked at the 755 nanometer picosecond laser with diffractive lens array, or the PicoSure with a focused lens array, since I believe this is non-CME. And this is a specialized optical handpiece, the focused lens array, that concentrates 70% of the total energy through high fluence microspots, with the remaining 30% giving some background energy to create these LIOBs, or these laser-induced optical breakdowns, very superficially, which can help regenerate the skin and the superficial papillary dermis. I think this figure is very important. This is something Mirko and Bo created, and Emil presented last year, I believe, for the first time at ASLMS, showing a lower fluence of 0.4 on the left and a higher fluence of 0.71 on the right. And you can see that the vertical tagline is the epidermal temperature near the DEJ, and the different colors are the rep rate. And the orange line is the threshold, where if you are pulse stacking very high, you're going to increase his temperature, and you have to be careful, because if we increase his temperature high enough, we increase our risk of getting PIH in these darker skin of color patients. And I encourage everyone at 10 hertz, use it on some burn paper, and you can see how much you're actually stacking. So with a lot of these higher energy treatments, I do recommend going down at 5 hertz, which we did for many of our treatments, whereas 10 hertz, you run the risk of getting more PIH. So I think this is a very important figure to increase the safety of what we're doing in skin of color patients. So we enrolled 24 subjects at our laser center in New York, acne scars on the cheeks, and of course optional other facial areas, for 4 monthly treatments with 30 and 90-day follow-up. 17 subjects completed the follow-up. Mean age was 33.9 years. The majority were women, and of course, it's all skin types 5 and 6. For physician gaze, everyone had improvement at 30-day and 90-day. As expected, the PicoSure Focus has been around for years, and we know it works. What we're trying to show is that it works in darker skin, and it's safe in darker skin. We were using the 6mm spot size for the focus lens array, which treats at a fluence of 0.71. And for blinded review by 3 independent physicians, looking at the responder rate, it was 73% at 1 month, which increased even more to 82% at 3 months. So I think there is some remodeling that's happening, which we're capturing at 3 months, and this mimics what we see with a lot of our treatments that we're doing in clinical practice. We're now looking at the 5mm spot size as well, which goes up to a higher fluence of 1. So the subjects were also satisfied, which is important for what we do, and the satisfaction continued all the way to 3 months out. For safety, there was mild patient discomfort using optional Zimmer cooling, but no unexpected events, no severe adverse events, still the same minimal downtime that we've come to know over the years in lighter Fitzpatrick skin types. Here are some before and afters showing improvement in skin texture, even PIH, like Paul was saying, but also in the scarring, which is what we were originally looking at. And this is reproducible all throughout our cohort that we had. And the patients, even after the 4 monthly treatments, kept on asking for more, which I think says a lot about the PicoSure Focus device. And the pictures go on and on. So in conclusion, the PicoSure Focus in darker skin types, Fitzpatrick's 5 and 6, this device is effective and it's safe at fluences of 0.71. Thank you.